Well, hello, everybody. It's week 2 of shelter in place here in Southern California. I'm Dr. Melanie Palm, and I decided to come from a second bathroom in my home today to talk to you a little bit about more skincare secrets from the dermatologist. And this time I thought I would talk about something near and dear to my heart, and I've even got a little helper that might be in the corner here. But it's called melasma, and melasma is this pigmentary disorder that is super common amongst women, and it's a multifactorial condition. So it's not only being female, and it's not only having sun exposure, but it's also heat and inflammation, I think, tend to play a role in this typical condition. So I thought I'd share a little bit about what I recommend to patients, what I use myself, and some, in the case of tough cases, how do we sort of combat it with out-of-the-box solutions. So how do I start out my morning regimen, and what do I recommend to patients? I actually use a glycolic acid wash, which is an alpha hydroxy acid. It helps with a little bit of collagen growth, but it also interferes with abnormal pigmentation and tyrosinase activity. After I'm done with that, my hero ingredient is actually using these hydroquinone pads. We have private labeled ones from Art of Skin MD, and they've got variable amounts of hydroquinone in them. They've got kojic acid, arbutin in them, as well as berberry and some antioxidants, and they really are true brightening ingredients that interfere with abnormal pigmentation. Once I'm done with those toning pads, I select a vitamin C, either serum or lotion, and I alternate between these two. We have our own private line of vitamin C. It's very stable. It's in a serum preparation, but I think another nice alternative to this is the Revision C+ correcting complex. It's a 30% ascorbic acid in a very, very stable and effective form of vitamin C. Once I've prepped with the glycolic acid wash and the vitamin C, then it's time for sunscreen. And most of the time I select one of these Elta MD products. I absolutely love Replenish and Elements. Replenish is basically just an untinted version of the tinted Elements. They have a little hyaluronic acid in them, so they tend to moisturize the skin a little bit, and they're purely physical. They've got a great amount of zinc oxide. If you look at the active ingredients, it's 10%, as well as a little bit of titanium dioxide. As I go throughout the day, you need reapplication, and if it's you're in a place where you actually have makeup on, obviously it's hard to reapply lotion. So something I use is these Sunforgettable SPF 50 brushes from Color Science. You can use it anywhere. They come in various tints, and some of the tints are just basically non-tinted, so they're safe even for our male patients. At nighttime, I use much of this same routine, but I add on a retinoid. And so we tend to use an Obagi tretinoin. Retin-A Micro is a very well-known one. Differin Gel is over-the-counter now. I'm using a new prescription one called Altrino. And you could consider, if retinols really irritate your skin, using a product such as Isden Melatonin, or this happens to be a retinol and bakuchiol in one product from Topics. And so that kind of completes your topical skincare. It literally takes me 30 seconds in the morning and 30 seconds at night, and really, really has calmed down melasma that I deal with in this sunny climate, even despite being very careful about the amount of sun exposure that I have. Well, what else can we do? Something that I am a big fan of is hot yoga. So I usually do that once to twice a week, and I found that my pigmentation related to melasma was actually worsening, and that's because the vascular component of melasma, I think, is oftentimes really underappreciated. And so something I've started doing, and you would need to ask your board certified dermatologist if this could be used off-label, but is a topical called Rofate, and it's oxymetazoline, and that's basically a vasoconstrictor. So I put it on an hour before my hot class, and my cheeks don't flush so much, and I've found that it really controls my melasma in a more meaningful way. And then a daily supplement that I take that I really try and encourage patients to consider is this HelioCare Ultra, and it's a tablet of Polypodium leucotomus, which is a fern plant extract, and I take this in the morning. It doesn't give me vitamin belly at all, and the Ultra has a formulation with pomegranate, so it's actually a super, super boost of antioxidants, so you have something systemically protecting some of that antioxidant stimulus and oxidative damage and inflammation that I think can make pigmentation worse. Well, now you've got all the secrets from the dermatologist in her bathroom. I'll try to bring you more educational activities, but in the time being, please be safe, be well. We'll get through this together, and we'll be on the lookout for sunnier, safer times. Thanks so much.